Hello to everyone. For those who have an interest, this is our project called Clinical Key for Electrical Stimulation, Physiotherapy and Rehabilitation. This project was founded by the Erasmus program of the European Union. These are the project partners. Our coordinator is represented by Pamukkale University from Denizli, Turkey. The rest of the partners are University of Craiova from Craiova, Romania, Hatay Mustafa Kemal University from Hatay, Turkey, Başkent University from Ankara, Turkey, Süleyman Demirel University from Isparta, Turkey, Šiauliai State University of Applied Sciences from Šiauliai, Lithuania, Burdur Mehmet Akif Ersoy University from Burdur, Turkey, and we also have collaboration with associations such as Turkish Physiotherapy Association, Order of Physiotherapists in Romania, Lithuanian Physiotherapy Association, and Estonian Association of Physiotherapists. My name is Eva Ilie. I am representing University of Craiova, Faculty of Physical Education and Sports, Department of Physical Therapy and Sports Medicine from Romania. My subject today will be about mid-frequency current under the Module 2, currents used for electrical stimulation. Medium frequency alternating currents spanning frequencies from 1 to 10 kHz play a significant role in physiotherapy and rehabilitation programs due to their versatile applications. In this range, two very used frequencies stand out: 4 kHz, referred to as interferential currents, and 2.5 kHz, known as Russian currents. These frequencies hold preeminence because the skin acts as a capacitive barrier against current flow. With increasing frequency, skin impedance diminishes, so allowing enhanced current penetration and more impactful therapeutic effect. To the adaptation of medium frequency alternating currents like interferential currents and Russian currents showcase their potential for facilitating effective and targeted interventions in various therapeutic sessions. Medium frequency alternating currents also often modulate to produce bursts of sinusoidal current, with the frequency of these bursts typically ranging from 1 to 150 Hz. It is believed that the nerve fiber responds to sensitive kilohertz frequency pulses, so thus generating by each cycle of alternating current stimulus, and will sum up to produce a single action potential in response to each burst of these medium frequency alternating currents. The expected nerve firing at the modulation frequency suggests that the physiological and therapeutic effects would be similar to those observed with low frequencies pulsed currents. So based on these assumptions, it is predicted that the response to medium frequency alternating currents would be primarily influenced by changes in skin impedance rather than the carrier frequency itself. So in other words, higher carrier frequencies are expected to provide more efficient stimulation of deeply located nerves. Physiotherapists commonly use transcutaneous electrical stimulation for therapeutic purposes. They have the option to choose between different frequencies, and modes of applications for the alternating current. The current can be applied directly or continuously, or it can be delivered as a series of pulses. Each type of current has its own advantages and, of course, disadvantages when it's used in the selected therapy. Evidence-based electrotherapy promotes faster patient recovery by utilizing applied energy as a trigger to stimulate physiological events, leading in this way to therapeutic benefits and, of course, the major point in our discussions will pain relief. Through the application of medium frequency alternating currents, a low frequency interference current is generated, so offering in this way the advantages of a low frequency stimulation without the undesirable side effects like pain or skin irritation, discomfort, and this approach will enhance the therapeutic expectancies and outcomes. Interferential therapy, interferential current therapy, involves transcutaneous electrical stimulation utilizing frequency currents typically centered around 4 kilohertz. The interferential current therapy in this kind of therapy, the interplay of two slightly distinct medium frequency currents gives rise to an amplitude modulate low frequency current spanning from 0 to 250 Hz. Interferential current has two major advantages: reduced skin impedance and amplitude modulate frequency. When talking about reduced skin impedance, we are actually talking about the current transmission through the skin. For the amplitude modulate frequency, this generates a low frequency current for deep treatment penetration. In the case of theoretical physiological mechanism, this stand out gate control theory, which refers to modulation of pain signals through spinal gating mechanism, increased circulation, that means the enhance of blood flow through the treated area by using interferential currents, descending pain suppression, the activation of descending inhibitory pathways, blocked nerve conduction, interference with nerve signals, and the placebo effect is actually a psychological factor contributing to pain relief. Two types of interferential currents are available: the true interferential currents and pre-modulated interferential currents. True interferential current involves the use of electrodes with two medium frequency alternating currents applied through two isolated circuits. The currents are intended to interfere inside the tissue, producing the desired therapeutic effect. In premodulate interferential current, the interference of the two medium frequency currents occur within the mechanism itself, the machine itself. So the resulting wave, which is an amplitude modulate current, is then transmitted to the tissue using a single pair of electrodes. Since its inception, the interferential current have been employed in clinical settings to alleviate pain, and address various symptoms associated with musculoskeletal injuries. We have principles of this type of current, and the main principle of the interferential current therapy is based on the relationship between skin impedance and the frequency of stimulation. This skin impedance factor decreases as the frequency increases, so it can be also expressed by using a formula which is referred to Z equals half of Fc, where Z represents basically the impedance in ohms, F represents frequency in hertz, and C represents the capacity of the skin in micro farads. By using medium frequency alternating currents, we will have the following benefits. Skin impedance, as mentioned before, a reduced impedance. It enables effective stimulation, improving penetration and energy efficiency. And when combined of two medium frequency currents slightly out of phase, it will stimulate tissue efficiently. This type of medium frequencies could be fixed frequency with 4000 Hz and adjustable frequency at 4000, 4220 and 50 Hz. So this will react under the principle of interference for tissue penetration and nerve stimulation. 5 key clinical applications has been shown appropriate with beneficial potential for interferential current therapy. These are the following: alleviating and managing acute and chronic pain, stimulating muscle engagement and supporting muscle rehabilitation, amplifying blood circulation and enhancing tissue oxygen supply, diminishing edema and fostering the reduction of swelling, and aiding in the healing and restoration of soft tissue. In management of pain, the interferential currents therapy's analgesic effect operates through the Wedensky inhibition of type C nociceptive fibers and the pain gate theory. The pain gate theory proposes the large diameter myelinated afferent nerves counteract small diameters unmyelinated pain fibers, effectively closing the gate to pain information, thereby diminishing the pain perception. So, moreover, a descending pain suppression mechanism is activated in response to pain, releasing endogenous opiates that inhibit the subsequent transmission of pain signals. So, interferential current is harnessed to address acute and chronic pain stemming from diverse origins. This includes post-traumatic pain, which may arise due to injuries or accidents, pain with sympathetic involvement, as seen in conditions like shoulder-hand syndrome, reflex sympathetic dystrophy, and Raynaud's disease, and higher frequency, approximately 100 Hz, when applied at sensory levels, can trigger pain gate mechanisms. effectively masking pain perception. In contrast, lower frequencies, up to 10 Hz, applied at motor levels, stimulate opioid mechanisms leading to the release of endogenous opioids for pain relief. So, in this way, interferential current therapy can also mitigate sympathetic activity, providing relief in cases of where the pain is sympathetically maintained. In the management of muscle, neurons exhibiting Walensky inhibition, also known as Gilder-Meister effect, in response to interferential current therapy, exhibit reduced sensitivity and an independent firing rate, closely resembling to normal contractions, and also the low frequency neuromuscular stimulation involves the requirement of easily fatigued muscle fibers in a synchronous pattern distinct from the usual contraction pattern. This distinction highlights the unique impact of interferential currents on a neuromuscular response. Interferential current therapy encompasses a variety of applications, such as easing muscle spasm to alleviate pain and stiffness, slowing or preventing muscle atrophy due to disuse, assisting in muscle re-education after injuries or surgeries, enhancing coordination, strength, and control, sustaining or enhancing joint range of motion, mitigating stiffness and contractures. Achieving muscle contraction involves stimulation of motor nerves with frequencies ranging from 10 to 50 Hz, lower frequencies to 1 and 10 Hz, resulting in twitches, while higher frequencies from 50 Hz induce sustained tetanic contraction. So parameters are selected based on the desire of therapeutic effect and goals, underscoring the tailored nature of interferential current therapy. Regarding management of circulation and edema, interferential current stimulation at 100 Hz exhibits effectiveness in effectively reducing acute edema, as also this outcome is achieved through a multifaceted mechanism that involves stimulating the musculoskeletal pump, inhibiting sympathetic activity, and influencing cell membrane permeability. For addressing chronic edema, there is a two-stage strategy and is commonly employed in this case. Initially, a 100 Hz frequency is used to induce vasodilatation, promoting increasing of the blood flow. Subsequently, a lower frequency of 10 Hz is implemented to aid in fluid removal, addressing both vascular issues and efficient drainage. So this comprehensive approach acknowledges the distinct nature of acute and chronic edema and tailors the therapy for optimal results. In this case, the interferential current therapy is elicit increased vasodilatation through two primary mechanisms. One is the activation of parasympathetic fibers. The therapy triggers parasympathetic fibers, contributing to enhanced blood flow by dilating blood vessels and promoting improved circulation. And the other one is inhibition of sympathetic activity. By impeding sympathetic activity, interferential current therapy counters arterial constriction, a particularly advantageous aspect for individuals with circulatory disorders such as Raynaud's disease. So for optimal outcomes, typically the beat frequency utilized with interferential current therapy is 15 Hz, or a sweep range of 10 to 25 Hz. This range is strategically chosen to effectively promote pain relief and to deliver therapeutic advantages by focusing on specific physiological responses. Interferential current therapy stimulates targeted effects in tissues, further augmenting its therapeutic potential. In the management of tissue healing, while interferential current stimulation therapy has demonstrated promising results in managing acute fractures of the tibia and fibula, its utilization for tissue healing is not extensively prevalent. So specifically a treatment regime involving a frequency of 20 Hz for a duration of 20 minutes, 5 days per week, has yielded favorable outcomes in fracture management. Despite these positive findings, the broader adoption of interferential current therapy for tissue healing remains somehow limited. So challenges related to its integration into fracture treatment protocols may contribute to this constraint. As the field of therapeutic interventions continues to evolve, ongoing research and exploration are vital to better understand the potential benefits of the application of interferential current therapy in diverse clinical contexts. Interferential current stimulation therapy elicits a range of effects on cellular process through its impact on various biomechanical factors. These effects include alternation in cycling adenosine monophosphate, these levels of this, acetylcholine esterase activity, and the function of enzymes such as alkaline phosphates. So these changes collectively contribute to promotion of nerve repair, tissue regeneration, and bone healing, underscoring the therapeutic potential effect of interferential current therapy in the management of tissue healing. Moreover, in specific clinical scenarios, the application of interferential current therapy has demonstrated notable benefits. So, for instance, when administered at a frequency of 20 Hz for a duration of 20 minutes, the interferential current therapy has been found to enhance mandibular fracture healing, and also when employed for 100 Hz for 20 minutes, interferential current therapy accelerates the resolution for conditions such as aesthetics atrophy and pseudarthrosis. So these findings underscore the promising role of interferential current in facilitating healing and recovery in these specific conditions. As research continues to uncover the underlying mechanism and therapeutic applications of interferential current therapy, its potential to enhance healing process and support recovery in diverse clinical contexts becomes increasingly apparent. In the management of urinary incontinence, interferential current therapy has demonstrated advantages for patients with both stress and urge incontinence, despite the distinct underlying causes of these conditions. Stress incontinence arises from an ineffective urethral sphincter mechanism leading to urinary leakage during activities that exert pressure on the bladder. On the other hand, urge incontinence results from the disinhibition of the detrusor muscle, causing sudden and uncomfortable urges to urinate, often leading to leakage. The efficiency of interferential current therapy in addressing these desperate forms of incontinence highlights its potential as a versatile intervention for improving bladder control and addressing related issues in patients with diverse underlying causes. In the case of the management of urinary incontinence, patients affected by stress, urge, or mixed incontinence have reported reduced micturition frequency following IVS therapy at 0 to 10 Hz for 15 minutes, 3 times per week. This underlines the potential of this type of therapy for symptoms management and enhancing bladder control across various incontinence types. For urge incontinence specifically, IVS therapy at 5 to 10 Hz for 30 minutes effectively targets small afferent fibers in the pudendal nerve. So this mechanism triggers reflex inhibitory of the detrusor muscle and contraction of pelvic floor muscle, aiding in urge incontinence treatment. Nonetheless, while evidence supports its application in stress and urge incontinence, clinical evaluation is limited. So the interferential current therapy isn't effective for anorectal incontinence, for example. The key treatment parameters in interferential current therapy include frequency, which is the frequency range extending from 1 Hz to 10,000 Hz is chosen according to the desired therapeutic effect. The amplitude, that noted in milliamperes, is tailored to the individual's comfort level. Treatment duration, it varies in minutes contingent on specific condition being addressed and patient's response to the treatment. Electrode placement, the strategic positioning of electrodes is determined, of course, by the targeted area and intended effect, and also the technique that is employed. Treatment frequency is the frequency of the therapy sessions, whether per week or per day, is adapted to suit the individual's particular needs and therapeutic goals of the clinician. By meticulously adjusting these parameters, practitioners optimize the therapeutic impact of the interferential current treatment while catering to each patient's unique requirements. We will put a mark on the frequency because this is one of the most important key. So for the treatment of sympathetic nerve, we will choose from 1 to 5 Hz, parasympathetic nerve from 10 to 100 Hz. The motor nerves will be treated from 10 to 15 Hz as a frequency, sensory nerves from 9 to 100 Hz, nociceptive fibers from 9 to 150 Hz, and the smooth muscles from 0 to 10 Hz. These are the references that stood in the creation of this presentation. This is our beautiful team, and I want to thank everyone for your attention and for your patience. Have a pleasant day.